So this is Dr. Shoemaker. I want to do a short video on bunions or hallux valgus as is described here. And you can see from this picture it's an angulation of the big toe and the metatarsal bone behind it. In the bigger picture, if you look here, the front of the foot's here and the back of the foot is here. In a straight foot, these bones are all aligned, but with a bunion, it ends up that the foot can be rotated or pronated away from the back of the foot, and the foot will actually make an S as it goes out, and you end up with a shape like this where the alignment is then off. So when a bunion is evaluated, we take an x-ray to check the position of these sesamoid bones. We ideally like to have the tibial sesamoid to be on this position here, and in a bunion, you see from that other picture, they migrate towards the inner space, towards the other toe here. And so this surgery is designed to try to rebalance this. Now there's traditional surgery, you make an incision about so big from the base of the toe down into the middle of the foot. It ends up being about 4 or 5 centimeters long to get in there and essentially take the joint apart and then shave the bump off, and then we'll break the bone to either correct the angle this way or else actually cut it and shift it over and then put screws in it to hold it in place. And then sometimes we'll also break the bone here to swing the toe out further. So in the end, the bunion has to be understood that it's a joint that's out of balance. There are multiple causes for it. You want to address those causes. Those additional causes include the flattening in the back of the foot. It also includes a tight Achilles tendon where the foot's trying to compensate for that. Now with bunion surgery, there's what I would call a functional or cosmetic bunion repair, and that can be done with small incisions, and as is drawn here, you can even do a small incision through and cut the bone through a small incision and swing it in, and then also then the first metatarsal head can be approached through small incisions as well. But in a traditional surgery, if you were going to break it here and here, you'd end up with an incision all the way across in here, close to 8 inches long. If you do a minimal incision, or what I call a cosmetic functional incision, you can have a smaller incision here, here, and possibly here, which will, with the help of an x-ray machine called a C-arm, you can see those cuts and move the bone and remove the bump as well. Now, I had also patients in their 30s and elderly patients who just want the bump shaved down and maybe just taking some of the tension off the toe so it can spring back a little bit, and that can be done through what I would call more of a minor bunion repair, and we would make that recommendation again after looking at the overall function of the foot and also what the patient's goals are. So that's kind of a short discussion on what's called hallux valgus or a bunion.